Hi, I'm Dr. Greg Castello, board certified family practice, and today we're going to talk about celiac disease or gluten sensitivity. And we'll start with what is gluten. Gluten is a protein found in wheat primarily, but rye and barley and perhaps oats, and it's the body's inability to handle or digest this protein that's called celiac disease or gluten sensitivity or gluten enteropathy are fancy terms for this. So first off, symptoms of celiac disease. This is a very popular diagnosis and a common issue today, and it is in children primarily failure to thrive, weight loss, abdominal bloating, irritability, poor dentition, sores in the mouth, diarrhea, watery, foul-smelling stools, and developmental delays. These are all symptoms of a celiac disease in a child. An adult who has celiac disease may have abdominal pain, bloating, cramps, complain of fatigue, and more vague type of symptoms as opposed to more specific symptoms like a child. We have testing for celiac. There's a blood test called a anti-TGG test. Not very sensitive, meaning if you have the condition, it may be negative. It's not a great test. The gold standard for diagnosing celiac disease is a endoscopy, where they put you to sleep, put a camera down your throat, and take a sample or a biopsy of the duodenum, the first part of the small intestine, and look for damage to the lining of the intestine. If you have celiac disease, it's a very difficult diet to follow. You get no wheat in your diet, no rye, no barley, and probably no oats. So the majority of your processed foods, including cereals and bread and pasta and these type of things, are wheat containing, so you are really limited to proteins like chicken and fish and meat, fruits and vegetables. Rice is okay, and maybe oats are okay if they're certified as gluten-free. The problem is that we have a significant increase in the diagnosis of celiac or gluten sensitivity in people that are actually not actually having this condition. What happens is that people go on a gluten-free diet and they feel better. Gluten-free diets are great. It's low in processed foods and starches. It forces you to eat fruits and vegetables and nuts and stay away from things like bread and pasta and tortillas. And guess what? When you eat a healthy diet, you feel better, but it's not necessarily an indication of celiac or gluten sensitivity. So when I have a patient who comes in and wants to talk about celiac disease, I just don't recommend testing. I'd rather them do a month-long trial, and if they feel better, regardless of whether it's celiac or just they're on a healthy diet, they can stay on that diet. If they don't have a significant improvement, then it's not likely celiac disease, and they can go back to their regular diet, even though a celiac diet is actually very healthy for you. Celiac was first described in about the 2nd century AD when someone in Greece noted symptoms of abdominal pain and bloating and diarrhea in people that had paleness and inability to work, and diagnosed it or called it celiac, which has a Latin derivation that means abdomen. The modern era of celiac disease was in about the mid-1880s when we recognized that there was some dietary things that went on with abdominal pain and failure to thrive in children. We officially came up with wheat and gluten in actually 1944 when a Dutch pediatrician noted during a wheat famine, when there was a significantly decreased availability of wheat flour, that there was a 35% decrease in death and illness in children that had already been diagnosed as celiac disease, and then the absolute relationship between wheat and celiac was established, and then in 1952 is when the gluten protein was further identified. This is not an allergy, so you can have wheat allergy. This is actually an insensitivity to the protein gluten, and it causes chronic inflammation of the intestine and actually damage to the intestine, and then the intestines are poorly able to absorb nutrients. So we oftentimes will see vitamin deficiencies, A, D, E, and K, the fat-soluble vitamins. We can see a iron deficiency and anemia. So this was originally described as abdominal pain and pallor, and that was from anemia. Vitamin D deficiency, so bone issues. Osteoporosis can also be associated with this. B12, folic acid deficiencies, sometimes liver abnormalities. So if I was to do celiac testing in the office, it would not generally be based on someone who comes in and says, I feel tired or I'm bloated, but more likely if someone was anemic and I didn't have a good explanation, or they had a significant vitamin deficiency, or absolutely in a child if they're having weight loss or failure to thrive or some of the other symptoms, it's very difficult to put a child on a wheat-free diet, and I'd like some concrete rationale as to why we would try that. But in an adult, you can make your own decisions and try wheat-free, and you can tell me whether you feel better or not. So celiac disease, gluten sensitivity, gluten enteropathy, all different terms for the same condition. It is specifically a protein in wheat that causes abdominal pain and symptoms. It is an autoimmune reaction that causes chronic inflammation of the intestine. It is treatable only at this point by being on a gluten-free or wheat-free diet. Dr. Greg Castello, thanks.